Did you know that when the lungs start to struggle, the symptoms are not always obvious? Being aware of the early warning signals can help you take action before lung damage becomes severe. Here are 13 silent signs that your lungs may be struggling and why it's important to pay attention to these red flags. Number 1. Shortness of breath with minimal effort. Shortness of breath is one of the most common signs that your lungs may be struggling. If you notice that activities that used to feel easy, such as walking up the stairs, carrying groceries, or light exercise, are now causing you to feel winded, it could indicate that your lungs are not functioning as they should. This symptom often sneaks up on people, and they may dismiss it as a sign of aging or being out of shape. However, shortness of breath can signal the early stages of chronic conditions like chronic obstructive pulmonary disease, COPD, asthma or pulmonary fibrosis, which restrict your lungs' ability to efficiently exchange oxygen and carbon dioxide. Ignoring shortness of breath can lead to worsening of underlying lung issues over time. When your lungs are struggling, your body isn't getting enough oxygen, which can cause fatigue and make daily tasks more difficult. While it may be tempting to push through, it's crucial to recognize this as a red flag. If you find yourself frequently short of breath without a clear reason, it's important to seek medical advice and potentially undergo tests like spirometry to assess your lung function and catch any early signs of lung disease. Number 2. Chronic cough. A chronic cough is defined as one that lasts 8 weeks or longer and can be dry or with phlegm. Often, people brush off a persistent cough, attributing it to allergies, postnasal drip, or lingering effects of a cold. However, a continuous cough without a clear cause could be an early indication that your lungs are inflamed or irritated. Conditions such as asthma, COPD, or even lung cancer often manifest with a chronic cough long before more severe symptoms emerge. The cough may be worse at night or after physical exertion and could gradually worsen over time. This persistent cough puts strain on the lungs and can lead to complications if left untreated. Over time, the coughing itself can irritate the airways, creating a cycle of inflammation and damage. A chronic cough shouldn't be ignored, especially if accompanied by other symptoms like wheezing, chest discomfort, or shortness of breath. Consulting with a healthcare provider can help determine the underlying cause of the cough, whether it's an infection, asthma, or something more serious like lung disease, and begin appropriate treatment early on. Number 3. Wheezing. Wheezing is a high-pitched whistling sound that occurs when you breathe, particularly during exhalation. It's usually caused by narrowed or blocked airways and is a hallmark symptom of asthma. However, wheezing can also indicate other lung conditions such as COPD, bronchitis, or an allergic reaction that causes airway constriction. People with mild asthma may experience wheezing occasionally, while those with more severe lung conditions may wheeze frequently, especially during physical activity or in cold air. Persistent wheezing suggests that your airways are inflamed or obstructed, making it harder for air to pass through the lungs. This can severely limit your oxygen intake and lead to fatigue, chest tightness, and breathlessness. While occasional wheezing may not seem alarming, it's crucial to pay attention to the frequency and severity. If you find that you're wheezing more often or with increased intensity, it's essential to consult a doctor. Before we proceed to the next sign, be sure to hit the subscribe button. Number 4. Fatigue or feeling tired all the time. Fatigue is a subtle but telling sign that your lungs may be underperforming. When your lungs struggle to take in enough oxygen, your body has to work harder to perform basic tasks, leaving you feeling constantly drained. If you're always feeling tired or fatigued, especially after mild physical activity, it could be due to poor oxygen exchange in your lungs. Conditions like COPD, interstitial lung disease, or undiagnosed asthma can cause the body to work overtime to compensate for diminished lung function, resulting in overall exhaustion. The relationship between oxygen intake and energy levels is critical. When your lungs can't supply enough oxygen to your cells, the body's energy production is compromised. This can lead to a persistent feeling of weakness, lethargy, and difficulty concentrating. If you find that your fatigue is unrelieved by rest or worsens over time, especially if combined with other respiratory symptoms. It's important to consider your lung health. Number 5. Frequent respiratory infections. Frequent respiratory infections, such as bronchitis, pneumonia, or sinus infections, could indicate that your lungs are struggling to clear mucus or fight off harmful bacteria and viruses. Healthy lungs help filter out germs and protect your body from infections. But when lung function is compromised, you may become more susceptible to illness. If you notice that you're catching colds, the flu, or respiratory infections more often than usual, it could be a sign that your lungs are weakened, making it easier for bacteria and viruses to take hold. Repeated infections also put a strain on your immune system and lungs, potentially leading to chronic inflammation and damage. Over time, this cycle of infection and inflammation can worsen lung function, contributing to conditions like chronic bronchitis or even progressing to COPD. Number 6. Chest pain or discomfort. Chest pain or discomfort, especially when breathing deeply or coughing, can be a silent sign that something is wrong with your lungs. While chest pain is often associated with heart problems, it can also be a symptom of lung-related issues such as inflammation of the lining around the lungs, pneumonia, or pulmonary embolism. This pain is often sharp and localized, and it may worsen with movement or deep breathing. Ignoring chest pain can lead to severe consequences, especially if it's linked to a serious condition like a pulmonary embolism, which is a blood clot in the lungs that can be life-threatening. Even if the pain is mild, it's important to consult a doctor if you experience unexplained chest discomfort. Early diagnosis can help manage underlying lung conditions before they worsen, ensuring that your lungs remain healthy and functional. Number 7. Difficulty breathing while lying down. Difficulty breathing while lying flat, known as orthopnea, can be a subtle but significant sign of lung or heart problems. If you find yourself needing to prop yourself up with pillows to breathe comfortably at night, it could indicate that your lungs are struggling to handle fluid buildup. Often linked to conditions like COPD, congestive heart failure, or even pulmonary edema. Orthopnea can make sleep difficult and leave you feeling fatigued during the day due to poor oxygen exchange at night. Lying flat increases the pressure on the lungs and chest, making it harder for weakened lungs to fully expand. This can worsen breathing problems, reduce oxygen levels, and lead to nighttime awakenings. Over time, untreated orthopnea can exacerbate lung issues, contributing to sleep apnea, fatigue, and a decline in overall lung function. If you notice that you're having difficulty breathing while lying down, it's important to consult a healthcare provider for a thorough evaluation of both your lung and heart health. Number 8. Swollen ankles or feet. Swelling in the ankles, feet, or legs, known as peripheral edema, may seem unrelated to lung health, but can be a sign that your lungs and heart are under strain. When the lungs aren't functioning properly, it can lead to poor circulation, causing fluid to accumulate in the extremities. This is especially common in conditions like pulmonary hypertension or right-sided heart failure, where the heart struggles to pump blood efficiently due to lung disease. Swelling in the lower limbs often accompanies shortness of breath, fatigue, and other respiratory symptoms. Left untreated, peripheral edema can worsen over time, leading to discomfort, difficulty walking, and an increased risk of infections in the swollen areas. If you notice persistent swelling in your ankles or feet, especially in combination with breathing difficulties, it's essential to seek medical advice. Early intervention can help prevent further complications and protect both your lungs and cardiovascular system. Number 9. Hoarseness or loss of voice. A persistently hoarse voice or a noticeable change in your voice that lasts for weeks could be a warning sign that your lungs or airways are under strain. This symptom is often caused by inflammation or irritation of the vocal cords due to chronic coughing or lung diseases like bronchitis, asthma, or lung cancer. A hoarse voice can develop gradually and may come and go, but if it persists, it should be checked by a healthcare provider. In addition to lung issues, a hoarse voice can result from acid reflux or throat infections. But if it's accompanied by other respiratory symptoms, like coughing or wheezing, it could indicate that your airways are inflamed. Early detection of the underlying cause is important to prevent further damage to both the lungs and the vocal cords. Consulting a doctor to determine the cause of hoarseness can help protect your lung health and prevent long-term complications. Number 10. Dizziness or lightheadedness. Dizziness or lightheadedness, especially during physical activities, can be a sign that your lungs aren't delivering enough oxygen to your body. When your lungs struggle to take in sufficient air, your brain may receive less oxygen, causing you to feel faint or unsteady. This symptom is often associated with lung conditions like COPD, asthma, or pulmonary embolism, where oxygen intake is compromised. If dizziness occurs frequently or becomes more severe, it could indicate that your lung function is declining. Fainting or lightheadedness during exercise or daily activities is a serious sign that your body isn't receiving adequate oxygen. If you experience these symptoms, especially along with shortness of breath or chest pain, it's crucial to seek medical attention to assess your lung health and prevent further complications. Number 11. Sleep apnea or snoring. Loud snoring or pauses in breathing during sleep, known as sleep apnea, can be a sign that your lungs and airways are struggling. Sleep apnea deprives your body of oxygen during the night, which can lead to fatigue, high blood pressure, and even heart disease over time. While sleep apnea is often linked to obesity, it can also be caused by underlying lung conditions that affect the airways. Sleep apnea not only disrupts sleep, but also impacts lung function by reducing oxygen intake. Untreated sleep apnea can lead to more serious lung and cardiovascular issues. If you or a partner notices frequent snoring or interruptions in breathing during the night, it's important to seek a diagnosis and treatment, which may include lifestyle changes, breathing devices, or further evaluation of your lung health. Number 12. Rapid or irregular heartbeat. A rapid or irregular heartbeat, known as arrhythmia, can be a subtle yet important sign that your lungs are struggling. When your lungs aren't working efficiently, your heart has to compensate by pumping faster to deliver oxygen to the rest of your body. This extra workload can cause palpitations, chest discomfort, and an increased heart rate. Conditions like COPD, asthma, or pulmonary embolism often lead to this type of cardiovascular strain. If you experience a rapid or irregular heartbeat, especially if it's accompanied by other lung-related symptoms like shortness of breath or chest pain, it's important to seek medical attention. Arrhythmias linked to lung dysfunction can lead to serious complications, including heart failure or stroke. Early diagnosis and treatment can help protect both your heart and lungs from further damage. Number 13. Fingernail clubbing. Fingernail clubbing is a physical change where the tips of your fingers become enlarged and the nails curve downward. This can be a sign of low oxygen levels in the blood, often linked to chronic lung diseases like COPD and pulmonary fibrosis. Clubbing occurs gradually and may not cause discomfort, but it's a clear indicator that your lungs are not providing sufficient oxygen to your body. Clubbing can also be accompanied by other symptoms like shortness of breath, coughing, or fatigue. If you notice changes in the shape of your nails or fingers, it's essential to consult a healthcare provider to investigate the cause. Early detection of lung conditions associated with clubbing can prevent further lung damage and improve overall oxygen levels in the body. If you found this video helpful, please give it a thumbs up. Thank you for watching, and for more amazing videos, subscribe to our channel.